Okay, good afternoon, everyone. Welcome to the Dental Tribune Study Club. I hope today that you're going to hear from me some information about less invasive dentistry, offering lasers, and we're really talking about clinical solutions. A bit of background on myself. I've been working with Henry Schein for over 10 years now. I've been working across Europe, giving lectures on lasers, so I'm hoping today that you'll hear something that will stimulate some interest for yourself. I'm not sure whether you've got lasers, you've been looking at lasers, you may have a friend that has a laser, or you may have been using lasers for many years. So I think hopefully I've made a presentation that's kind of a bit about everything for everybody today. So in the UK, we obviously work with Henry Schein and Optident. And so if you're interested in lasers from the end of this presentation, please leave your email details on the portal so we can obviously help you on to the next step. So today is all about clinical solutions, and hopefully you'll be able to understand how lasers can help you in practice. Most important thing is which wavelength. So there are many laser wavelengths out there, and they all have different sort of properties. So I think today we're going to talk about the different wavelengths and where they are in the absorption table. So if you have a look at this chart here, you can see that the diode laser has an absorption in hemoglobin, oxyhemoglobin, a little bit of water. So it's the melanin area, it's the color area. So diode lasers have a high absorption in color. The Nd:YAG is the other laser in this area. The erbium lasers, that's the erbium YAG and the erbium YSGG. Their absorption table is roughly around the water section, but also a little bit hydroxyapatite. And obviously the CO2 laser is more about hydroxyapatite. So what I'm trying to say here is different lasers do different things. So we're going to concentrate today on two. That's the diode laser and the YSGG, which is the Waterlase brand. It's a melanin, hemoglobin, oxyhemoglobin, so diode laser is looking for color, and the YSGG is looking for hydroxyapatite and water. So they do different things. They also have a different depth of penetration when it comes to absorption. So when it comes to the Nd:YAG lasers, they are the deepest penetrating as far as absorption is concerned, and they're very good for cosmetic use and also disinfection. Diode lasers are really good for low-level laser therapy and biostimulation because of this depth of penetration, but they also, when you're cutting them, you have to initiate the tip so that you're bringing the surface cut to a similar to the erbium YAG you can see over here and the erbium YSGG. They're very superficial with their cut and very, very gentle indeed. So it gives you an idea that different lasers do different things. So what are the characteristics of laser light? It's pretty special, very powerful, coherent in the same time and also the same space. Monochromatic means there are many different lasers out there. If you are using lasers, you probably would be using diode lasers or erbium lasers, but you may be using CO2 lasers. And obviously in ophthalmic, we use different lasers, so they're not all the same. Collimation means they travel in a straight line, and you'll see some of the bigger erbium lasers have to have mirrors or articulated arms to transfer this light. But what's the effect of tissue from lasers? Reflection, always make sure you use your goggles and check the ocular hazard distance on your laser when you use your laser. Transmission is very exciting. You can use laser energy, and for example on the erbium laser you can take off veneers intact because the erbium laser doesn't see porcelain. It's transmitted through the porcelain and will denature the cement on the other side, and so you can take off veneers intact. Sometimes they do ping across the room and sometimes you have to leave them off, but you can, make sure that you don't destroy the underlying structure. With transmission on diode lasers, you can use this effect on tissue to actually decontaminate in the endo canal because it doesn't see dentinal tubules, and therefore it will actually mean that it goes through and you can use very high level decontamination. Most of the time we're looking for absorption. We're looking for laser energy to be cutting. And that's why it's very important when you do pick a laser to find the right wavelength. Scattering is really an exciting opportunity by using individual molecules and deflecting them into the tissue. So this way we can actually use it to give pain therapy, also decontamination. So low-level laser therapy is pretty exciting on the tissue, and we have different handpieces that you can do this with. And what we're doing is really creating this massive sort of cellular energy by absorbing this extra light and stimulating the healing cascade. So biostimulation is healing in low power. So ulcers, cold sore, soft tissue healing, desensitization, and you're stimulating the cell reproduction. So if you increase the power, you're heading towards biomodulation, which is pain therapy. And that's fantastic for TMJ and myofascial pain. So what we're doing in that situation is we're blocking the A fibers in the melanin and increasing the lymph gland into drainage. So it's good for swelling and good for pain. So lasers don't just cut. This is the science behind it. So obviously increasing the ATP, the fibroblasts, the odontoblasts, decreasing the blood flow initially in extraction sites, which gets you faster clotting, followed by the increase of blood flow to allow healing. So this is fantastic. And also for reducing edema, decreasing inflammation, increasing microcirculation. The most important thing is you are creating a healing cascade, which allows the tissue to heal faster. So let's talk about the diode laser first. This is a diode laser that we're talking about today. It's from Waterlase. It's the Epic X or the Epic 10. These lasers are really high absorption in hemoglobin, oxyhemoglobin, and water. The wavelength is a 940 nanometer. And they also have this comfortable cutting because they have this way of comfort pulse where they have an energy pulse and a thermal relaxation in between. So therefore the energy has a cooling system. So you're cutting without heat. So the benefits of diode lasers, because they have a reduced zone of necrosis, tissue stays where it cuts. And it's less damage and less tissue repair, less histamine release. Because the margins stay where they cut, obviously because the tissue is healing and it's predictable, so you don't have to worry about shrinkage. No bleeding and great visibility. Actually, the laser can stop bleeding, so it can be a problem solver. It sterilizes as it cuts, so it's fantastic in perio and endo treatment. And also low-level laser therapy, which is fantastic. Better clinical outcome. This is what we're looking for with a diode laser. You can see that there are various different treatments, and I will show you some videos now of the different treatments you can use the diode laser for. But I would hope you look at it as a problem solver and an everyday product. This is a new laser from Waterlase. It's called the Epic Pro, and basically it is actually 10 times the peak power of a standard diode. So it's a really high peak power, but up to 20,000 pulses per second. So it's very, very, very fast. So therefore there's very little heat. So I think this has just been launched. So just to give you a quick recap on the Waterlase technology, the erbium laser, yttrium, scandium, gallium, garnet is a ruby crystal, and it's a high absorption in water. So when we have this fantastic energy coming down the handpiece where it meets a water molecule, it explodes a water molecule. So excitation of water, as it expands, it kills the bugs. As it contracts, it takes the bugs away. And this photoacoustic streaming is fantastic, not only in the cutting aspect of antimicrobial, but also in endo and perio. And there's no heat to the tissue because it's basically steam that breaks the tissue apart. So you're looking at individual cells that are absorbed and also laser energy turning into vapor. So this is how it cuts. Now, if you're cutting with a scalpel, the zone of necrosis, the damage around the cut, is up to 300 cell layers. You have bleeding, you have swelling, you have pain. And obviously we're looking for something that will have you give you better visibility. And I know the electrosurgery unit, some of you may use electrosurgery units. They're 1,500 cell layers. So obviously you can't use them around metal, not so good on implants. And obviously they are a little bit aggressive. So we're looking for a gentle way of cutting that doesn't have bleeding. So diode lasers are fine. They are 15 to 25 cell layers. A bit more gentle is the erbium laser, 3 to 10 cell layers. So very good for oral surgeons because you can cut without bleeding, but also you can see where you're cutting. But you do need visibility because if you're having only 3 cell layers and you are looking at sort of less feedback, you do need good visibility. So there's also a cascade, a change to the healing cascade. When you're working with normal healing cascade, you have barrier clot, inflammation, tissue regeneration, remodeling. When you work with a laser, you bypass inflammation and go straight to regeneration. So you really are, if anyone's already using a laser, I'm sure the first thing they would say is how quickly the healing is pretty dramatic, how fast the healing is. The Analgesic Effect. This is, especially with the erbium laser, you can block the C fibers to the brain, the sodium pump, and you can create anesthetic free. Really, it's only for enamel cutting. You wouldn't be doing this on some surgery, but certainly for a patient point of view, if you're looking for something that's going to be less gentle, less aggressive, more gentle, and the patient sort of benefit. So these are the Waterlase I Plus. This is the latest model. They do come in different colours, but this is a fantastic tool. It's very, very good, very effective. Optident are the distributor in the UK, and this is the new Express, which is their new tabletop laser. It has a fantastic sort of iPad tutorial. It's less power, but it's fantastic for soft tissue, bone, endo, perio, so ideal for a specialist as well, or for someone who's working with oral surgery. So soft tissue and bone is really exciting to be seen. You need to have some experience with this laser to see how fast it cuts. So hard tissue with the YSGG, you can see that you can cut fillings. If you're looking at the difference between a laser cut and a burr cut, obviously one is, you can create microfractures, you can create heat with the burr. There isn't any microfractures, less heat, and also a 50% increase in bond strength. This is one of Professor Moritz's studies, and also less smear layer as well. So is the reason to buy a laser only for using for fillings? I wouldn't say so, but it's very useful, especially for children or for phobic patients. And you can see a class 3 here that you can see cutting. It's very clean. There's no vibration, there's no touch. So for a patient point of view, I think it's a winner. And again, if you're under 20 and over 50, I think you'll find that the analgesic effect works better. But in the last 10 years, I've been working with lasers. I've seen many, many fillings without injection, and I know that some of you actually use it as a marketing tool as well. So you can see it cuts very gently. It's not going to run away with you. Again, you do need good visibility, so loops especially, so you can see where you're cutting. And you come on one of the courses. Mark Cronshaw, I've been working with him for many, many years. He's really one of our top laser trainers in the Isle of Wight. He does many courses, and you'll be able to work on extracted teeth, and you'll get the idea of how to cut. So there's lots of angulation. You can see how he's constantly changing the angle, because the cut is literally just beyond the tip. So it's not going to run away with you, and you're it's very, very precise. And you can see how quickly it's cutting in that respect. Again, this is no anesthetic. All the videos I'm showing you today for hard tissue are no anesthetic. And in the last 10 years, I've had a few myself, worked on a few teeth where I needed a filling. And again, you don't feel anything, as long as your apparator is working properly and obviously had some training. Class 5s, I would say subgingival decay, subgingival bleeding. I'm sure this is one of the areas where it's difficult to do with a burr, because once you've got bleeding, it's not so easy to work together. So this is actually a composite class 5, and you can see that within a very short period of time you can get rid of the soft tissue, and gently you can remove the composite. Again, this is without anesthetic, and this is one of the easiest ones as far as without anesthetic, because you're able to get through the energy of the laser to the pulp and block the sodium pump a little easier in that respect. So here we are, just removing that composite, and then you've got a nice clean finish, again on the cusp as well. So again, many dentists use lasers for cutting enamel. If any of you have original MD lasers, the I Plus is double the power, so you might find that actually the MD was a little slower on cutting and can be a little bit frustrating, but obviously any laser will gradually get faster as technology gets better. So soft tissue is really the #1 use for me as far as working with the erbium laser. And you can see this is one of our videos from the Express, so it shows you how cleanly you can cut a gingivectomy. I guess you guys are doing it with scalpel at the moment, or a burr, or electrosurgery unit, maybe a diode. But I think that the cleanliness of an erbium laser is really, really special. And you can see that it's very precise, so it's not going to run away with you. Again, this is obviously a video from our Express, but obviously if you want to see it with a diode laser, this is one of Mark Cronshaw's earliest videos, by the way. His teeth are not that yellow. This is one of his earliest videos. He's really perfected his videos since then, but I do like this one, because not only is it a diode cutting for soft tissue crown lengthening, but he's also going to do osseous crown lengthening. He's proving here that you can do, if you didn't have an erbium laser, which would be better for you, you could do osseous crown lengthening with a diode, and you could use the little chisels. And he's going to use a little chisel in a minute, which he'll have a 3mm biological width marker on it, so that he can see where he wants to remove the bone. So I think in some respects, here's your chisel. I mean, obviously, if money isn't necessarily an object in some respects, and you're looking for something that will really benefit the practice, the erbium laser is fantastic because you can do the soft tissue and the bone, and it's a lot more gentle than using chisel tips like this one here. But again, the diode laser obviously is ideal for the soft tissue management. So I'm going to move on, and you can show you actually before and after. So yes, diode laser, fantastic. Small areas of soft tissue removal, but will not touch bone, will not be there for hard tissue. This is an erbium crown lengthening, and this is just gingivectomy. This particular patient, they didn't have any need for cutting bone, so it's purely soft tissue. This is one of the earliest I+'s actually, because of the green aiming being they're all red now. And you can see this is quite a young person, so a little bit of contouring. You can see it's almost a bit like sort of drawing on the tissue. It's like working with a paintbrush. No bleeding there. Great visibility, very precise, and you can finish with a really nice result. They're using a chisel tip there, which is really good because it's shaped like a chisel. You can move it in the shaft of the handpiece, so it can be directed also if you wanted a thin biotype. And you can see that they moved it down to the other side. So you're literally just able to sculpt that tissue so that you can get it exactly where you want it to be. And a very, very pleasing result indeed. So no sutures, no raising of a flap. So Waterlase smile. This is a gingivectomy, before and after. Crown lengthening, obviously osseous crown lengthening. I'm not sure at the moment what you're doing, whether you're sending it away to periodontist or doing it yourself, but I'm guessing the majority of people who are doing it or sending it away are raising a flap. This is pretty aggressive. Obviously, I'm sure you all see this before, but maybe it's something that you don't do yourself. And I think patients, it's not that easy for patients to see the benefit at this stage of the procedure. But there are many people who are doing smile makeovers, and I'm sure this is everyday practice for you. But if you could do it a little easier, if the patient could get a better result in a faster healing time, maybe that would be something to look at. So this is again a video from our Express, just to give you an idea of what we're doing. So obviously soft tissue removal first. Once you've taken away the soft tissue, then actually you can do the bone without raising a flap. So what we need to do here is obviously aim the tissue, the tip inside, and just remove it. You see there's a marker on the tip there, just to sort of give you the indication of where the tip should finish on the new crest or the new margin. And it's very straightforward. Again, I would recommend leaving your email details so that we can give you information on courses. We have a fantastic team in Optident that will also have all the lasers that can help you with pig jaws, and you can see this firsthand. Excuse me. So you can see that you can smooth down this bone and get a very, very pleasing result without raising a flap. So for the patient point of view, obviously that sounds a little bit more sort of acceptable, and you can then fine tune it and give it a nice aesthetic look. So if you want to see it in real time, obviously this is the cutting of the soft tissue. Again, you can either follow the long axis of the tooth, or you can cut down towards the tooth, but it's like cutting butter. So you can use it with a stint. Oliver Harmon, who we work with, he has Waterlase MD, and he uses a stint, but he'll have the patient wear a temporary for some time, and then he can adjust the soft tissue and bone accordingly. We have many people, Robin Halton, that also works with implants, and obviously Rena Alfalaki, who's our top periodontist. So we have a whole fantastic team that we work with as far as giving courses, and obviously if you can give your details as well, then you'll be able to have education available to you. So once they've taken away the soft tissue, you can see we've got a new margin to follow. And as I showed you in the last video, then they were able to put the tip in, and then they're able to cut the bone to match. Again, it's obviously unusual for you to sort of not have visibility at this point. I understand that, but we actually teach you on pig's jaws, and it's very, very, very gentle. And you can see exactly when you do raise a flap on the pig's jaw, you can see exactly where the margins are, and you can see how gentle this is as a procedure. So it's an alternative for you if you are doing osseous crown lengthening, or it's also ideal for you if you have maybe referred this procedure in the past and would like to try it yourself. Patients do prefer to stay, if possible, with you, and so it's maybe a new process that you'd be looking at doing. And you can see that sometimes you need to thin the biotype. So by reducing this biotype, you can actually, it's sculpturing tissue really. It's almost I would call it your sort of soft tissue art. And as you know, hard tissue is more predictable than soft tissue, excuse me, because soft tissue has a mind of its own. So the ideal situation is that you can actually sculpt the soft tissue without bleeding. Again, marking to just double check where your biological width is. So before marking the tissue, cutting the tissue, you can see the result. It's very, very clean, very, very dry, and you're able to see where you're working. This is before, during, just after, and as you can see, courtesy of Rana Al-Falaki here, fantastic result. Very gentle, very very, very gentle is the word. Here is actually a patient who is a bruxist. You can see that one of Mark Cronshaw's patients here, he's marked the tissue, and the sort of middle right is temporized on the same day. Bottom right is 2 weeks apart. So you can see a little bit of healing to be done around the incisors there, but I think a very good result in 2 weeks. And also, if you have the invasion of the biological width, then sometimes, obviously, if you inherit something like this, then again, you can use the laser even onto fantastic new veneers. You can use the laser just to remove a little bit of bone, obviously, to solve this problem. Frenectomies. I'm not sure whether you do frenectomies, whether you refer them. We see them. I'm sure we see them, even if we don't actually have a solution for them. So again, this is a video from our Express. And you can use the laser. Both lasers are very, very good for frenectomy. So erbium laser or diode. The diode is very good because it's obviously high absorption in color. So, you know, frenectomies can be a bit bloody sometimes. And the ideal thing is to use a laser that obviously promotes hemostasis. And this one, obviously, you can do by turning the water and the air off. But if you have a look at the video of a diode, this is almost 100% tongue tie. My own personal experience, both my children were tongue tied, and this is before I was working with lasers, so we had to use scalpel. It wasn't the nicest experience, but you can see in real time this is very quick. A little bit of 3-in-1 air aspiration. There is a slight plume, especially with a diode laser. So as long as you've got high speed evacuation there, then you're going to have very little smell to the patient. But this is under topical gel. Diode is a little bit more, there's a little bit more heat to diode laser, so I would always use topical with diode or anesthetic. And you can see sinew by sinew by sinew, gently removing that tissue. So I would say a diode especially is a bit of a problem solver. There's awkward bits of tissue that you want to remove. And you're almost done there. Again with a Waterlase. So one is exploding water, ideal for soft tissue and hard tissue. And one of them is also for it's absorbed into color, so it's very good for coagulation and for bleeding. But the diode will not see hard tissue. So one is a purely soft tissue and pain therapy, bacterial reduction. You can see with the Waterlase, it's sinew by sinew. Also, what's really important in this video is you can see that there's also an antimicrobial plume. As you can see that the water that is energized by laser is totally disinfecting the area. So if you're working with round implants and you work with a laser, you really are able to remove bacteria at the same time. Again, 12 months post-op, you can see how the healing is fantastic. Obviously, this is a Waterlase, so again, no anesthetic. The children, it's a lot easier if you haven't got to get an injection out. And you can see that this is, cutting and kind of cutting and gluing at the same time, really. So there's no sutures needed for frenectomies. And these are almost real time. So this is something that you could do easily in your practice. Maybe there's a solution that I'm not sure if you're referring them at the moment, but I think patients prefer to stay with you. You'd have someone with a nice tight pull on that frenum. That's key when you're working with a frenum, is just a nice tight pull on it, so you've got a bit of tightness on the tissue there, and then you can remove the tissue gently with the Waterlase. And you can see 9 months later, the teeth came through beautifully. Again, after 6 weeks. So healing is very quick. Sulcus troughing, I'm guessing you're using cord at the moment, maybe. Not as easy when you are trying to take the cord out, it starts bleeding. If you're using some kind of CAD/CAM system, or the CEREC or anything else, it's ideal if you want to get a nice dry image. Again, this is an image from one of our Express, the new videos, so ideal for tutorials. And you can see that sometimes you actually want to remove more tissue than just doing a bit of troughing. You've broken down crown, or you've got a cusp that's broken and you want to remove a bit more tissue so you can build up the tooth a bit more. It's ideal in that respect. And this is actually a diode in action, so very gentle. I'm not going to run away with you. You get a fantastic impression. So again, you may need to remove a little bit more tissue interproximally there as well. You get nice long tips with the diode, easy to sort of fit into these places here. And as I said at the beginning, also when you're working with diode lasers, if you want to do biostimulation, then you don't have initiated tip. But you can see when you want to cut, you need to bring the energy to the surface, and therefore you initiate it. And then you can use it around the crown. You get a great impression. So again, using it with the CEREC is ideal, or one of your CAD/CAM systems. For implants, I think I mentioned at the beginning, the electrosurgery unit, you can't touch metal. So obviously the fact that you can go around and you can unscrew remove the tissue around your abutments is fantastic. WaterlaseClub.com, I will mention it again at the end, have some great videos on this. So if you want to do some extra tuition, today really is just about stimulation to give you an idea of what you can do with lasers. And then we have many, many options of learning after this. But WaterlaseClub.com is a really good opportunity for you to learn how to use this around your implants. So this is the Waterlase doing the same thing. You can see the difference between the lasers now. I think a lot of people that have diodes do go on and sometimes get an erbium as well, because diode is fantastic with its soft tissue and also biostimulation, but also the erbium is great with bone as well. Sorry about my cough. And here we are exposing the abutment. And again, remember the antimicrobial plume. Just imagine all this energy that's in the water is disinfecting at the same time. So extractions, laser-assisted extractions. When you're working with laser, they are laser-assisted. It's an adjunct. But if you're trying to preserve the bone, then working with a laser where you can actually move it around like a peritone, and then you can lever it out more gently. Less traumatic for the patient, and also better for yourself as far as preserving the bone. Again, you can see the antimicrobial plume there, so the fact that it's completely sterilizing as it works. Bone management. Sinus elevation. I'm not sure if you guys are doing implants, but we have a tip that has a power density on the outside and not on the inside, so that you can't actually burst the membrane. And on courses, they teach it on raw eggs, so you can actually take away the shell and leave the membrane intact. That was one of the first things I did 10 years ago when I started working with lasers. I actually went over to Germany with an amazing dentist, Thomas Hanman, and he did a sinus elevation. Patient had no swelling afterwards and was one of his nurses. Excuse me, and he came in the next day and literally she had no swelling. So I was very, very impressed how quickly this was. Excuse me, my cough. Endo. So we can do fantastic decontamination with the laser. So when you're working with the Waterlase, we have this radial firing tip. So you have the energy out the sides and less out at the tip, so you create a bubble. And this bubble exploding rushes to the apex, bursts any bubble that you can't get there. And as it does so, it opens up all the tubules. So you are able to decontaminate up to 1 millimeter in about 30 seconds. So if you're using bleach or you're using even just saline solution, it's a matter of removing the bacteria and keeping up this, removing the smear layer. Diode laser is basically bacterial reduction. So basically the diode laser will kill bacteria up to 3 to 4 millimeters into the lateral canal. So I think in some respects, if you had the option of both, I would say that that would be the perfect solution, because what you can do with the Waterlase is you can remove the bacteria. And then with the diode, you're obviously able to kill the remaining bacteria. So this is a very good animation from our express laser. You can see that the bubbles on your hand, you would never know that they were existing. If you put that tip on your hand, you can hardly feel it. But once you put them inside the enclosed canal and you fill it with liquid, it's almost a tsunami. And so it's breaking up all the calculus and breaking up all the, getting all the infection out and opening up all the tubules, allowing you to remove these nasty bugs. I'm sure you know more about them than I do, but I know they've been linked to bowel cancer and various other bits. So these are very nasty bugs. And so, it's really about an adjunct. Again, Waterlase is an adjunct in endo, as it is in perio, for removing infection. So if you had a diode now and you were able to use a diode laser in there, then you'd be able to kill those remaining bugs. So perio. Obviously, Dr. Rena Al-Falaki is one of our leading clinicians as far as perio is concerned, and she's been using lasers for about 8 years now. And she's been doing lots of research with her. I've been working with Professor Francis using guys, and she has lots of papers that she's been writing as well. So she's running many courses. I just did one last weekend with Mark Cronshaw in the Isle of Wight, so a leading expert on perio. Obviously, I'm sure I'm not teaching you the links between sort of infection in the mouth and infection in the body, the systemic effects. But obviously, it's important. 45% of the adult population of this country have periodontal disease. So it's an area we need to look at. And obviously, the main concern for patients is saving their teeth. Obviously, it's important about, reinforcing positive health behaviors, but it's really about saving teeth for the patients. Lasers are really good as another tool, like a scaler. There are extra advantages in using them, but they have to be as an adjunct. And obviously, there are many studies, not all of them actually show the benefits of lasers, but the bacterial effects, the removal of biofilm, removal of smear layer, removal of calculus, removal of endotoxin and infected cementum. So it's all about, can we do this in a more gentle way? And what we're really looking for is obviously reattachment. And although it can happen spontaneously, it is unpredictable. So I think that when we work with lasers, we found that there are some new avenues of research. This is a slide to explain that now the GDC, should I say, have actually said that if a pocket debridement contains an element of removal of granulation tissue and is thus seemingly unavoidable and part of that task, then regardless of the instrument, this would be considered under scope of practice. So that means hygienists and therapists can use Waterlase and also diodes. So this is a really exciting opportunity. Diodes are very, very good at bacterial reduction. So if you're working with a diode laser as a hygienist, obviously it is really a very, very good tool to have in your practice. And it's very, very good for bacterial reduction. So with an uninitiated tip, you are killing the bacteria and thus leaving the area with less bacteria, less bugs. It also attracts the granulation tissue. If you are working as a dentist, you are able to initiate the tip and get rid of the lining. But bacterial reduction is very good, especially around implants as well. And as you can see, it's going through the actual sulcus a bit like a paintbrush and just cleaning out the bacteria. So, if you do this before you do ultrasonics, you're not removing live bacteria around the mouth. So if my suggestion would be diode laser for bacterial reduction, ultrasonics, and then biostimulation with a laser as well. And if you're using an EMS as well, then sometimes you don't have the opportunity of working with an EMS if you have inflammation. So you can use a laser to remove the inflammation first. But it does attract the granulation tissue, and it's this nasty, heavy-duty biofilm that obviously is the problem. And it is attracted to the diode laser because the diode laser is looking for color. So it is attracted, and also you're getting nice coagulation as well. So when the patient goes home, they haven't got bleeding in the mouth. So if you're using diode laser ultrasonics, then diode, the patient will go home without a mouthful of blood. And you can see that so even after this is cleaned down, which they're going to do in a second, they will clean it down. It gives it a very nice finish, but there's a few nasty pockets in there, as you can see. So he will go over those again, clean it on down, and then once he goes back into those pockets, you know, the heavy duty, you can start to see it sticking to the tip now. It's heavy duty, and it is attracted to the tip. Excuse me. So diode laser, bacterial reduction. Erbium laser. We have a radial firing tip here, and the radial firing tip is basically creating a bubble. So you've got the energy 80% coming out the sides, 20% down, you know, from the straight forward or similar to that, and it creates this bubble. So it's very much like cavitation, I suppose, but it's imploding the bubbles, and you're able to knock off the calculus and the tartar. So a good question to you guys at the moment is, what do you do when you're reaching a 7mm pocket? Do you refer it? Do you raise a flap? And obviously the key is that when we have patients that have got periodontal disease and they've got bone loss, if we could work with a patient up to 14mm without raising a flap, this would be ideal. And so we have now got these tips in 14mm, and they are able to reach even infiltrations. And it's an adjunct. Here's a video having a bit of a colourful moment there. But it's an adjunct. So again, we're removing all the infection. We're able to remove the lining. We're able to also micro-etch the root, which is helping for reattachment. So what we're aiming to here is to set up an environment for the body to create new bone. So we're removing infection, removing calculus, and this can be done up to 14mm. The tips will work up to 14mm. So you will see a lot of nasty calculus coming out that maybe you wouldn't have seen before. But if you can do this, and you have an opportunity of doing this yourself, you can see now he's micro-etching the root. This helps for reattachment. But it's all the bubbles. Again, this particular tip, if you put it on your hand, you would hardly feel it. So it's almost a tsunami inside the pocket. But it is a dual wavelength. You would actually go ahead now and you would use a diode to create a blood clot inside that pocket, because it's the blood that's going to create new bone. So you really want to sort of remove the infection, and now he'll go in with a diode and he'll start creating some bleeding. This is a diode in there, and you can see the blood coming through the bone now. And if we can fill up that pocket with blood, similar as you do when you're doing an extraction, then you would be able to sort of create the opportunity for the tissue to reform. So it's an adjunct. So you're going to use it to also remove the epithelium, because you want it to actually slow down the growth, so you can actually get the growth from within. So it's hand scaling, laser scaling, combining the two. So we're not comparing and saying one is better than the other. We say that together we can get a better result. This is one of Mark Cronshaw's, again, excuse the yellow teeth, as I say, it's one of his early videos. But this is actually a patient that has an abscess on the canine. And you can see the amount of extra calculus, or say granulation tissue with a little bit of calculus, that we can get out after he's done ultrasonics. So he's removing all this infection. And what he will do afterwards, he will actually just slightly denature the top of the tissue, just turn it a little bit white, as I say, to stop the ingrowth. And this will allow the healing to come from within. So it is very satisfying getting all this stuff out. And I think when you're working with your patients, sometimes getting this onto a bit of gauze and explaining this is why we've had problems with this tooth healing. But this is a 9mm pocket. We've got plenty of tip. We can continue down to 14mm. So this is an opportunity of cleaning out all these bugs. And you can see he'll start in a second just to turn that sort of margin inside and out, just literally over the rim, just to turn it a little bit white, just so that it doesn't, it slows it down. You can see it's a little bit of, just removing that lining now. And now he's denaturing the epithelium. Just turning it a bit white, just so that it slows it down. And the results, pretty good. More or less now we're doing one visit. Maybe a little bit shrinkage there, but you can see that the tissue is stipple pink and looking healthy. And after one treatment, this is one of Mark's in the Isle of Wight. The patient was away for 3 weeks on holiday, and that is 3 weeks later underneath. Obviously more to do, but very, very good. And you can see he's using dual wavelength. He's got the erbium laser primarily, and then he uses diode for healing. And you can see the tissue heals pretty well after 6 months. So, and one of these is one of Rena alpha laches, and you can see that the patient here, without any ortho treatment, after one treatment, the teeth went back into place because obviously the laser was removing the infection. Patient results, very little patient discomfort, reduction in inflammation, tissue change, color, consistency. Obviously, pocket probing is the key, but we're looking for bone regeneration. This would be ideal. And this is one of Rena alpha laches' first patients. Was a smoker, so not easy getting a blood clot. And you can see that even in the furcation, after 9 months, actually, I think it was 6 to 9 months, you can see how quickly the healing, I mean, the tissue grew back very quickly, but also the bone grew back very quickly. And you can see how that, especially in that furcation, that's pretty spectacular. Even 4 months. So 10 millimeter to 3 millimeter. This is one of Rena alpha laches, 7 to 2. And again, the patient didn't want to have surgery, so this is instead of surgery. So, you know, up to 3 to 5 millimeter pocketing where you can get in with ultrasonics. Diode is fantastic because it removes bacteria. But if you can't get to that calculus and you need to get more access, instead of doing surgery, this is ideal. So 10 millimeter again to 3 millimeter, or 10 to 2, 7 to 3. So you can see that these are actually, again, didn't want to have surgery. 12 millimeter pocketing to 3 millimeter, even under a bridge. This is one of Mark Cronshaw's. The patient had nothing to lose and the dentist had nothing to lose. And you can see after 6 months, 9 months, 18 months, and that's the journey. So one treatment and the bone continues to grow back. So what's the difference between the two? Obviously, more patient friendly. Patients don't like the word surgery, understood. Less expensive, lengthy material costs. Quick, can treat whole mouth. And also you have good visibility, which is key here. But it's also difficult to visualize through bleeding field. You know, if you guys are doing surgery, then you'd see this. It also can help regenerate bone and reduce mobility. Actually working with surgery initially increases mobility. Better aesthetics, can be poor aesthetics, especially when you've got surgery. Less sensitivity, of course, and obviously you're going to have a lot more pain with surgery. And you compete, which you can't do necessarily with the surgery for 2 years. Also, age limits. Peri-implantitis, obviously this massive problem we are having is that the more we place, the more that go wrong. So this is one of Rena alpha laches' designs. So she has been working with Waterlase, and she has created a side-firing tip. And the side-firing tip itself is purely designed to clean the threads, as you can see top right. There's a little video here. Bit of music to shut me up for a second. This is actually nail varnish. So nail varnish on the threads, and you can see how quickly this thread is being cleaned. Oops, sorry. Here you are. I'm just going to do that again because I missed this one. Okay, so here we have the radial firing tip. So the side firing has just been brought out. If you want more information on the side firing, you need to speak to Chris Meinl from Optident. The side firing tip is being tested by some of our esteemed implant specialists in the UK, so there should be some good articles coming out soon on it. But this is a radial firing tip, so still able to do this around your implants. And you can see that Rena alpha laches has been using it with the YSGG. So it's fine around the implant thread itself. Again, non-surgical. So it's the effect of this bubble, which is where we are removing the granulation tissue, removing calculus and cement, and decontamination and debridement of the infected surfaces. And it's also safe to the implant itself. And this is basically from Rena alpha laches. So you can see the bubble itself. It's creating this bubble, and this is where we are removing this calculus. Again, deep down inside. So, some of these implants really are, have a real defect. And yet we're able to do it without surgery. And I think Rena said to me that she did 2 surgeries last year. So, where she was doing a lot more surgery as a periodontist, she's now only doing 2. So hopefully less surgical. Pre-treatment, post-treatment, peri-implantitis, pocketing depth, that's very quick, 8 millimeters to 4 millimeters. So, and bleeding on probing, I mean, when Rena shows me some of her cases, the bleeding on probing is pretty much gone straight away. So tissue response, even more than bone, is immediate. This is one of her cases that she had in the BDJ. You can see that on the I think you had 2 threads on the distal and 4 threads on the mesial. This is 14 months apart. So yeah, bone growth around the implants again can happen spontaneously, but obviously it's not as predictable. And when you remove all this infection, you can see that these again before and after 1 year. So bone levels are leveling. But this one I was quite interested in because although you can see the bone growth. I was talking to a professor of periodontology in Italy, and one of the key things he was most excited about was the fact that more important than you had the sort of the bone growth, went from a 9 millimeter pocket to a 2 millimeter in 2 months. And he was pretty gobsmacked with that because that's obviously soft tissue healing very, very quickly around the implant. Again, we can do gingival graft with lasers, we can do connective tissue grafts, and also tissue harvesting. So, if you like surgery and you work with scalpels, then it would be really worth your while trying to sort of get some education or go and have an experience with a laser. This is one of the societies that Rena Al-Falaki has started. So if you have a look at Global Periodontal Laser User Society, and then obviously she has this society. So again, if you need any further information on this, then you can always ask us, and she has a society which covers all lasers, not just the Biolase brand. And also reverse vestibuloplasties. This is one of Larry Nuren's cases, preoperative obviously, and postoperative. So very, very quick, very, very effective, should I say. And also, less scarring. Depigmentation, I know that sometimes this can be a problem. Again, I've witnessed and worked with dentists. We've done it with diode and also erbium. Erbium is a little bit more gentle, but the results are fantastic again. So up to 6 months, and it continues to carry on. So would you ever go back? Conventional surgery as opposed to laser surgery. There's so much more you can have a look at with laser surgery. And I'm going to leave that on the screen for you to have a look at. But maybe it's worth you having a think after this small introductory into lasers. And maybe there's some opportunity. And the bit that matters to me is the antibiotics. Often needed, no need for antibiotics. So to me, using lasers and reducing the need for tablets is something that is definitely worth looking into. So it's all about education. So from here onwards, you can look online with Biolase, and also I mentioned biolaseclub.com. There's plenty of education on there. If you go on there and register, they have lots of diode courses, and so you can find out from Biolase. But also there are some websites here I'll leave on the screen regarding diode, also, especially the low-level laser therapy. But if you leave your details with the portal, we'll also be able to let you know of the courses that we run. So we do lots of hands-on courses. Now, if you can't always make a course, the Optident team, if it's an erbium situation or if it's the diode, also some of the surgical team in Schein are able to bring the lasers to your practice. So you can have some hands-on experience and also hands-on training. So again, it really is important to get close up and personal, especially with the pig's jaw, if possible. And you're able to sort of get an idea of what you can do. These are some of the courses that Optident are running. So you do have, I'm not sure how these are working right now, but I know you have, intermediate courses. Mark Cronshaw works with Rena Al-Falaki, and they also will give you an opportunity for trying the laser out. So I think I finished a little earlier today, but I thought I would have some opportunity for some questions. So really, it's about, is this the future, or really, what do you think? So maybe we could take a few questions if there's any questions there at the moment. No? Okay, fair enough. Hopefully everybody's actually learned a little bit more about lasers. So if you would like to leave your details with us, obviously the key is that this is a number here for Emma Marriott at Henry Schein Education. And so if you would like to know more information, then just please, give us a call. I hope today you've learned a little bit more about lasers and a little bit more about the opportunities for you. And thank you very much.